presentation of cats with arthritis is most often by the owner. I mean, you don't get to see the cat moving around. You can't palpate anything that might be wrong. So I would say information from the owner is the most likely way we're going to diagnose it. Okay. Usually they're telling me that the cat is maybe slower. The obvious thing, of course, would be limping. Sometimes I have to sort of draw the things out of them, but limping, not jumping up anymore on the bed, not jumping on the counter. Yes, the counter. Maybe not playing as much as it used to. But that's kind of hard to assess in an older cat anyway. I mean, what are they doing? They're eating, they're sleeping. Other signs of arthritis might be not using the litter box anymore or not using it very well.
Okay.
And that might be from painful positioning, pain in climbing over the edge of a litter box. Other presentations, I think just awkward gait. And I said most often it's going to be the owner that describes it to me.
Okay.
Or I might try to bring it out. If it's just a exam, vaccine, regular exam, I might be asking, is he acting like he used to?
Okay.
But signs can be subtle.
Oh, that's interesting. Okay, great. And in terms of treatment options, when an animal presents with arthritis, what are the steps that you take to diagnose arthritis?
Probably the best one, if the client is willing, is to do a radiograph, and here's what we get to see. The most common places for arthritis in the cat is sacrolumbar, right here. You'll see underneath all the lumbar vertebra, you might see spurs, really painful spurs developing.
Okay.
That's probably most common. Hip joints, probably not as common as in the dog. Knees are a real big place for arthritis in the cat. And then the next one is probably less likely is elbows. So in fact, I had a cat today that they described it as walking like a cowboy. That his legs were way out, and I could actually palpate that without any kind. I could feel that they were thickened. Sometimes you can feel it in the knees. I can never feel it in the spine, but the cat might act painful, on exam. So those are some of the most common places. I think we see it in the temporomandibular joint when a cat may not want to eat as well, say the teeth are fine, but he doesn't want to eat dry food anymore. Okay. So that's a little bit harder to diagnose because we don't X-ray or radiograph the skull of a cat very often because you have to sedate them.
What I see in alternative care is, the chiropractic and people also use the acupuncture and homeopathy as adjuncts to what the veterinarians are doing with the traditional Western medicine. And altogether it seems to help, but you're right, the weight is really, really important. And it's so easy for us to look at those little kitties or those little pups and go, oh, here, have another treat. Mm. And then they just get bigger and bigger and bigger. As the cats get older, they get a lot less active.
The other ways that you can manage these kitties at home that have the arthritis are just, if you just think of assisted living in cats, that's what we like to call it. And you can build ramps to the bed or wherever they might sleep. Steps. I know once again they probably touched on this with the dogs, but everything you can do for the dog, you can do for the cat. Lowering the side of a litter box can help. A bigger litter box, maybe they need a little more room to maneuver. I think another thing on the medical side, let me digress. If cats can get more easily constipated with arthritis, so that's another bad side effect. So stool softeners, increase fiber in the diet, pain control so that they don't mind squatting and doing their business. Right. But yeah, constipation can be definitely secondary to arthritis. So anyway, back to assisted living, raising the food bowls, and that's a dog thing, in fact, you can buy these elevated little bowls, in a stainless steel thing, so that they don't have to lean down so far to get their food. Got any other ideas from the dogs? Tell me.
No, the food, raising the food bowl is very good. The other thing people can do at home in the assisted living or even when they're younger is doing a little stretching with the cats. Cats are really good at stretching, but you can assist them when they're older and they can't do it. Maybe put the cat in your lap and just kind of elevate the kitty up a little bit just to get some stretching in the spine and a little bit of their passive range of motion in the limbs. I'm not going to do it on this poor guy because he's beyond help. But
he's pretty
if he wasn't, and we'll probably get to a live cat. We are, I think, going to show a live cat here.
Oh, yeah, I think we have some.
And so that's important, is getting a little bit of stretching going in these little guys, and just a little soft tissue work, and right up into here, massaging the little neck muscles. It helps with the increased blood flow and all that, and it helps relax the cat, and it helps with bonding with the owner.